All right, and we are live. My name is Hetal Doshi. I'm an organizational psychologist, and as part of an ongoing initiative to support the mental well being of our community, we have launched a series of interviews with experts and everyday heroes just like you and I. And today, with me, we're really privileged to have a friend and also an expert psychiatrist, Dr. Prem Kumar, who is a neuropsychiatrist by training and is also currently the head of Neurobehavioral Sciences, which is super fascinating, at the Penang Adventist Hospital, Malaysia. And he's also a lecturer in one of the universities in Penang, I think.
Yeah.
Yes, and I'll let Dr. Kumar share a little bit about who he is and the kind of interesting work that he's been focusing on. So on to you first.
Thank you, Hetal. Good evening, everyone. My name is Prem. I'm a neuropsychiatrist at Penang Adventist Hospital. And I also lecture. I'm an associate with the RUMC, which is your Royal College of Surgeons, University College, Dublin, Malaysia campus.
Right. And you've been a psychiatrist for how long now?
25 years.
Oh my good lordy. Why would
20 years qualified psychiatrist.
Why would you have wanted to be a psychiatrist? That's a pretty it's something that you either want to do. It's not something that you potentially chance upon. Why would you have chosen psychiatry as a specialization?
I guess it was something that I was fairly interested in right from medical school, and interactions with some patients in the course of my MOship days sort of guided me towards this path.
Mm-hmm.
It's really difficult to quantify when exactly the interest started.
When and how was it? Okay. And from your perspective, the 25 years of being in this space, why is it that people find it so difficult to do their own inner work and they need to go seek professional help for this?
I think a lot of it depends on their makeup, their emotional makeup. There could be some people who are quite resilient to start off with, and if you look at our parents, for example, they were very focused. Our parents and our grandparents were very focused on, guiding the family through hard times. They themselves would have experienced some hardships, global events and their effects within the country, and some sense of resilience would have developed in them.
Mm-hmm.
But the thing is, even at that time, there were such things as emotional disorders, but it was probably not something that people were very aware of, and it would have been brushed aside as just merely being something that's part of life, and you just manage. So
Right.
that is why, if you have been brought up in an environment where your parents or your grandparents had to struggle very hard, some amount of resilience could have been inculcated along.
Right. Okay. And on the contrary as well, I guess, if they haven't managed or coped well, then I guess the flip side of it would be that they passed on potentially poor coping mechanisms onto you as well.
If you look at how behavior is learned, I think there's a lot of modeling. So you have to keep that in mind, especially modeling behavior. So that could sort of have a huge impact on how someone reacts to a situation, how someone behaves in certain circumstances.
Right. That's quite interesting because as psychologists or psychiatrists, typically we would go back to childhood experiences and relationships with our parents and the
Yeah,
impact on us as well. And what you're trying to say is that that's pretty much predominantly where we begin to role model and learn
yeah,
behaviors as well.
yeah,
And a lot of it has to do with the reactions that we have in difficult circumstances, potentially too. Right. That's extremely valuable. And sometimes I will tell like my when I'm reacting badly, my parents are like, why are you reacting like that? I'm like, because you born me like that. So it's not my fault. I'm just like that because of you. But that's not nice. That's not nice. I guess with every generation we're supposed to evolve, but we don't really quite evolve. And sometimes we need potentially at least learning opportunities to break out of those patterns. So I guess let's go straight into it. COVID-19,
yeah.
extraordinary circumstance for everybody. What do you think about it and the symptoms that people are showing today? Are they uniquely different?
Okay. First and foremost, this is a totally unprecedented crisis. It's of such an economic magnitude that I don't think anyone in the world would have expected it to come to what it is.
Mm,
It is also something that has instilled a lot of fear in people because of the way news has been transmitted.
mm,
People are worried. Is this all there is to it?
mm,
How much further is the virus going to mutate? What's going to
mm,
happen to us? And this has led to a cascade of problems that we as psychiatrists are only now beginning to see. We
mm,
expect, when we had disasters in the past, when we had the tsunami in 2004, and then the very unfortunate incidents with our airlines, our two airlines.
mhm,
Um, those were considered disasters, and you, when you experience those things suddenly, normally you go through certain stages, and in
mm,
the disasters, you start off with the heroic stage where suddenly everyone um, bands together to help each other out. Then they move on to a sort of honeymoon stage that lasts between a week to 6 months, where um, people really, help each other. And then after that,
mhm,
for another 2 months or so, you actually have people who start to think more of themselves. A bit of self-centeredness comes in, and problems emerge because of
mhm,
um, misunderstandings. And after
mhm,
that, up to 1 year, uh, uh, up to about a period of 1 year, you go to a reconstruction stage, and everyone starts to get
mhm,
healed.
mhm,
Now we are seeing something that we knew was going to happen. We knew it
mhm,
at least 2 months before our lockdown was ordered. So it wasn't
mhm,
something that happened immediately. And what I
mhm,
find is happening is something slow that's evolving.
mhm,
And I don't know, I'm sure many people would have seen. I've been trying to get my head around it. How come everyone was so cool at the beginning when the
mhm,
announcements were made? Some people would
mhm,
have been really worried. And funnily, normally, we fall back on a lot of scientific data, but there's been this Venn diagram that's been going around social media, which I think is very relevant in our
mhm,
particular circumstance. It talks about three zones that people go through, the phases that people
mhm,
go through during a
mhm,
crisis. And I feel it relates quite well to what's
mhm,
happening with 19 in Malaysia.
mhm,
The first is the fear zone, right? This
mhm,
is when people are experience some sort of numbness. They are still coming to terms with what is actually happening.
mhm,
Some of them get angry and they complain a lot. it's during this phase that a lot of hoarding behavior begins,
A lot
or
of behavior, sorry?
hoarding behavior. People start
Mm,
buying a lot
right.
of things and stocking up because it's mainly out of fear. And it is
Mm,
also during this phase
mm,
where those who are scared will start fear mongering. They start
mm,
passing messages, negative messages, without
mm,
verifying them.
mm,
And I feel this phase related very well with our first lockdown, the first 2 weeks. And
right.
by the time it was extended,
Mm,
I think most people, quite a lot of people, went into another sort of zone, another phase
mm.
called the learning phase.
The what phase, sorry?
Learning.
Mm-hmm. Mm-hmm.
Um, they've had time alone to think and accept that there are things that are not within their control, and
Mm,
they are willing to let that go, right? And they start to avoid consuming things that are bad for them, whether it be food or bad news. If some of them initially had consumed more alcohol, they tend to realize that, oh, maybe, this might go on for a while longer. It's not going to be that healthy.
yeah.
So they start identifying with their emotions,
Mm-hmm.
and they are more aware of the present situation and of their
Mm,
actions.
mm,
So they would actually think twice before they um, pass on an unverified WhatsApp, something,
mm.
without finding out whether that's the actual thing that's
Right.
really going on.
Mm-hmm.
Um, and they basically they come to realization they come to a certain realization about their own abilities.
Mm,
They realize that, listen here, everyone is trying to do their best. The
mm,
frontliners are doing it. Our fellow citizens are staying home. They are complying. But yet,
mm,
at that time, there could be some apprehension because of the uncertainty of what's going to go on, what's going to happen in
mm,
the future.
mm,
And then, as acceptance starts to um, starts to become something that they know they have to be more aware of,
mm,
they, then we move into the next zone, which is the growth zone.
mm,
And you
mm,
can see this already happening within a lot of people. This is when charitable efforts to help others begin, because we know that a lot of people would have been kicked out of their accommodations. A lot of people may not have money, especially the daily wage earners. They may not have money to live from day to day. So some charitable um, efforts will happen. And for those who have
mm,
talents, I'm sure you are aware that Sheila Majid had a session every night for 45 minutes for what, 2.5, almost 3 weeks.
mm,
And these
mm,
are big gestures. A lot of musicians had come together just to
mm,
entertain people, knowing that everyone is in the same boat, everyone is stuck at home, they must be bored. We have
mm.
these skills and we try to help them. Some people
Right.
get some people get creative in this stage. They start sharing recipes
Mm,
online. Um,
mm,
they 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 communicate more with their friends, social
mm,
interactions by Zoom.
mm,
And not it could be to make themselves feel less isolated in one way, and the other way is they could have thought of someone whom they thought probably needed a bit of cheering up, and they
mm,
con- so this shows the empathy that people develop, empathy towards themselves as well as to others, and having
mm,
that sense of thankfulness
mm.
that at least they have what they have. you know.
Right. Okay. That's quite interesting. So I really like what you said about the stages that people go through, which you spoke about before, the zones that people go through. You talk about the heroic stage, right? Like I think that's so relatable. Like at the start, you're like, okay, let's do something for the world. Let's advocate for, I don't know, refugees or the vulnerable groups, and then I think the energy may dissipate a little bit. Like, say, for example, I remember in my condo at 8:30 p.m., the first day, everybody was out there like cheering and like screaming and dancing. And then 3 days later, you could see, okay, the honeymoon stage was kicking in. Everybody's like trying to
Yeah,
do it for a social cause. And then after that, it's like, hello, I just want to sleep. La. So you were saying the self-centric stage, and then it
yeah,
goes into the reconstructed stage, which is the new normal. Unfortunately, the new normal was the same as the old
yeah,
normal, unfortunately. But I
yeah.
guess that's what you're trying to say. In a business sense, it could be a different thing altogether.
Definitely, definitely.
Yeah, just
That's
specific to
why
that one.
yeah,
Yeah.
that's why I did mention that those stages that related to disasters, somehow it didn't move from one stage to the other as how it is happening now. It's evolving very slowly, and
Mm,
you can see that people are actually more understanding about
mm,
this, but there is also a limit. There are people
mm,
who have lost their income. I've started to get patients coming in saying that
mm,
they can't even see past the next 1 month, and
mm.
that's sad. So in these stages, what is important from our point of view as psychiatrists is to know what is normal and what is abnormal. You see,
Mm,
so good. Now let me take you back to that Venn diagram that I was talking about, which I feel
mm,
it's best to our current situation. The
mm,
first zone, the fear zone. If you're feeling numb and you are not able to make sense of what's going on, if
mm,
you have that initial relief, oh, I've been so busy at work, now I don't have to go to work for 2 weeks, you're forgiven. Even if you felt relief for the wrong reasons, that is a normal reaction. However, if there's persistent
mm.
um, negative negativity or feeling of dread in the fear zone, and or even in the learning zone, then we would deem it as being something
Right,
abnormal.
right.
We,
So
yeah, sorry.
we are going into symptoms, right? I guess what you're
Yeah.
talking about really is symptoms here, and you're saying that there is a new way of assessing symptoms in this situation. Is that correct?
Not really a new way. It's just some new data that we've
Mm,
just gotten from some of our colleagues in Canada, and they have basically identified the people at risk. But um, what they have felt is basically people who are older,
mm-hmm,
those who are younger,
mm-hmm,
those who those who have had a past history of a mental issue, a
mm-hmm,
mental illness,
mm-hmm.
those that are compulsively going on social media to obtain news about the current situation, statistics, right? And the fifth group would be the frontliners,
Mm,
because
right.
that's a very stressful place to be at the moment.
Mm,
And if I may, being in this line, I see our frontliners, our nurses, um, our medical officers,
mm,
our ambulance drivers. I see them on almost a daily basis on the few days that I go to work. And the
right.
thing, the things that increase their stress are basically uncertainty about a virus that's unknown.
Mm,
You know, every 2 3 weeks, some new
right.
development is happening, so they don't know how to handle that. There's also
Yeah.
uncertainty about the honesty of patients We have had some very unfortunate incidents where people have not disclosed that they had traveled, you
Yeah.
know,
Right.
as a
Right.
result infected some hospital staff. So it's very stressful. There's also uncertainty about how long the supply of PPEs, personal protective equipment, is going to last.
Yeah.
Okay,
Okay.
most of them are exhausted, and they have this fear of failing their patients, knowing
Mm,
that this could be something that can turn fulminant at any time.
right.
And last but not least, disruption of their personal life, their
Mm,
family interactions. Some of them are too scared to go and give intimate hugs to their young ones. So
yeah.
these are all things that add to stress.
Yeah. Yeah, absolutely. And so you were saying, okay, we were talking about demographics now with Dr. Prim, and the ones who seem to be at most risk are those who are, number one, very obsessive about the news. So those of you who are constantly watching the news, and I know I have friends who know the data of all the countries at the back of their mind, at the fingertips. Stop it. Is no value to you whatsoever. You are not in the government. You're not a medical professional. Just stop it. Let it go. So you don't need that information. You really don't need that information at all. So number one, those who are very obsessive about the news. Number two, you were saying those who have past history of mental illness as well. So those of you who have already existing mental health related concerns, and even maybe on medication or therapy or any kind of treatment. The third would be the frontliners that you were talking about.
Yep.
And then, sorry,
Sorry, go
yep.
ahead.
And lastly, you were talking about certain demographics as well, the elder folks or the younger ones potentially. And I'm really quite curious about the younger ones because I'm not sure whether they show symptoms in a different way. But so you're talking about the older ones, the younger ones. And I think before this, when we were having a chat, you were also talking about those who have recently gone through a bit of a crisis on their own. It could be personal or professional. You're talking about those who may have just recently gotten divorced.
Yeah,
Um,
sort of
yeah,
isolated, single parents, those living away from others,
yeah,
those who may be having financial difficulties or they don't have anyone else to turn to. I think
yeah,
these are people that we are trying to keep our eyes and ears open out to, so
yeah.
that we identify if they go into some form of emotional distress, because not having anyone to be able to talk to about your problems, or not having anyone to be able to just reflect what you may be feeling, whether it's frustration or loneliness, it can be quite detrimental to someone's mental health.
Yeah, absolutely. I think even in a normal circumstance, that's really hard. So much less in such a circumstance. You were also talking about those who are alone, right? So typically those who are single or single moms, you were saying as well, that are quite at high risk.
Single parents who are isolated, who do not have much family support, because we have to understand one thing: it's not just an, a normal everyday circumstance.
Mm,
People have been ordered to stay on their own. So
yeah,
if you have been recently separated, you have a kid with you,
mm,
you don't have any family, and all you have are your four walls and your kid,
yeah.
and if you can't go to work and earn a living, that's going to be quite devastating, I would
Yeah,
imagine.
sure. Certainly. I mean, there could be a lot of compounding
Yeah.
stressors that add up slowly. And like you say, it's quite a unique circumstance where it is staggered and it could be one thing adding on to another, to another, to another. So sorry I cut you off earlier, but what are some symptoms? You were talking about persistent numbness or
Yeah.
persistent
If I
negativity of dread.
I was looking through those. I found that Venn diagram really interesting, because I felt that the symptoms that you would expect from each of those stages, like the first stage, your fear stage, yes, there would be some numbing. Some people, um, would start making they would make too many contingency plans because they're anxious, they're worried, right?
Mm,
And as they move on, I mean, those are actually quite normal reactions, but
Mm.
abnormal reactions are basically if you are in a state of elated denial. It's a word I just coined up, there's no actual word, but you don't seem to want to understand the magnitude or accept the reality of the situation, and you continue to be totally happy about the whole circumstance, then I would be worried that something is not right, because it is usually at this stage where, from a psychiatric point of view, we do see people having acute stress disorders, and if it lasts beyond a certain time, it becomes an abnormal stress disorder.
Yeah, so
Okay?
that's quite interesting. I mean, I think you're somehow talking about some national leaders in potentially the Americas. But yeah, we will not go into politics. So what you're trying
Yeah.
to say is on the dichotomous part of things as well. So we're talking about dichotomy. You're talking about those who have extreme fear and those who have to seem to have like apathy, apathetic response to it all.
Yeah. I mean, it's fine if you've sorted out your finances and everything is okay. Some people actually do say they're actually having a good time. But yes, having a good time and being happy are two different things. Some people may be just relieved that they have this time to themselves for the first time in their lives, those that
Mm,
have worked hard. But there could also be a group of people
mm,
who have not grasped the reality of the whole situation. And that
mm,
can be worrying, because as you move into the next phase, the learning phase,
mm,
you would start to accept it, right?
mm.
Um, I would expect that there would still be some blaming going on at this stage, but there
Mm,
would be a more realistic outlook. There would still be
mm,
worrying, no doubt, but if there's still persistent negativity and dread, then there is something that we need to um, keep watching out for. If
mm,
there's guilt, undue guilt, if they keep blaming themselves for a lot of
mm,
things that's going
mm,
on, if they're isolating themselves, and if they seem very confused about what they should do, I would be
mm.
worried.
Right.
Because as people who have abnormal reactions, we need to move into the growth stage of
Mm,
this. If they
mm,
can't move to it, then
mm,
you are going to get the development of phobias,
mm,
anxiety issues,
mm,
you know, depression can set in, and that is the time when there'll be the highest chance for a relapse of a pre-existing illness to occur.
mm,
That continued stress.
mm. Right. Trying to make sense of the symptoms. So if how would I know whether how do I self-diagnose in a circumstance like this? So I like what you're trying to say in terms, I could break it up from what you're trying to say in terms of outlook. So how I'm viewing the circumstance.
Yeah.
The second thing is my emotional, what is going on inside of me, my emotional experience. And the third thing is my
Yeah.
behavior. So, from what I understand, if you have an outlook that is very, very bleak, how would you say? I mean, like in terms of outlook, what is
Yeah.
bad, what is okay, and what is great?
Like I said, when this thing first hits, when you are in a fear zone, it's
Mm,
natural for just about everyone to feel scared and to
mm,
have some amount of negativity. There
mm,
could be tearfulness, there could be this feeling of dread. But if
mm,
it persists, even
mm,
after a couple of weeks, then knowing that you've had time to sit down and put your life in order, try to map out what changes you need to make in life, and
mm.
after a few weeks, if you still can't seem to move on,
Yeah,
then it would be something to worry about.
right.
Now, don't get me wrong. I'm not saying that people shouldn't feel scared. Yes, I think everyone was scared at the beginning, but
Mm,
we slowly start to accept it. It's a
mm,
sort of process of evolution. If you're
mm,
still stuck in that phase where you still think that nothing good is going to come out of this, and you
mm,
keep spreading negative news,
mm,
then I would be worried about you not being able to handle this whole thing or enjoy it for some time longer.
mm.
And similarly, someone who is just so happy about it at the beginning, who obviously seems to be in denial and they continue to be happy, that doesn't mean that they are handling it well. They could
Right.
be just afraid to um, accept what they fear most.
Right. And so so okay, what I'm understanding is in terms of an outlook, if it is an excessively negative or bleak outlook, in terms of emotions, you're talking about emotions like numbness, persistent negativity, general negativity, dread, lack of
Yeah,
acceptance, constant fear, or maybe confusion. In terms of actions, too much of planning, a lot of contingency plans, a lot of blaming, a lot of panicking,
yeah,
and a lot of obsession as well in terms
yeah.
of behaviors. But you're also talking about if it is persistent or if it goes on for too long. What is too long? Like, how do you measure intensity?
You see, most of the time, these symptoms should um, they should dissipate within about 2 weeks. They should.
Mm,
But
mm,
like what I'm saying, we are in a different sort of crisis. Your that's why your recognized markers do not really apply here. This is an ongoing thing. Just when things get better in one country, we hear it gets worse in another part of the world. And then we
mm,
hear that, oh, some people are getting reinfected. How true that is, or whether um, it was just statistics that were not added in earlier. People do get scared.
So
So
are you trying to say that there is like a constant trigger that is occurring?
it appears to be. It's not that something bad has happened and it has finished and then you give them 2 weeks and they should get better. It's not like that. So that's why I say it's a bit difficult to quantify where
Mm,
this is concerned. But um, I would say that usually in about a week or 2 weeks, people start to understand the situation that they are
mm,
in, and they start
mm,
to make changes. I would, in my opinion, more than 2 weeks, I would say something is amiss. And I'm not saying that
mm,
they psychiatric treatment. Sometimes
mm,
maybe a bit of counseling or some other form of psychological help could, you know. And I'm
mm.
sure we'll discuss this in detail at our next session.
Yes, definitely. We'll talk about treatment options in the next section for
Yeah.
sure. This has been amazing. I'm curious. Are there any online tools that I can use to see whether I am in dire need of professional help immediately already? Because I mean, even me as a professional psychologist, an accredited one, I could see myself fitting into a couple of these things already.
I think
Um,
all of us went through it.
yeah, and I think
All
that
of us.
yeah, there is this also confusion that I have about um, what is the difference between somebody who is unable, I don't know, like highly functioning dysfunctional people. I don't know whether there's a term for it. Means I'm still able to perform at my job. I'm still racking in really good sales, but inside of me, there's a whole load of turmoil that is going on.
You're
Um,
talking about high achievers who need to put on a front that they are handling it well.
and I'm probably handling it on the outside really well. Still
That's
able to
the
function, still
term I
able to go to
picked up.
work. Sorry.
That's why I came up with that term, because I do see some of them, those with in a in a sense of elated denial of what's happening. It's
Mm.
going to be okay. Um, there are some that I'm seeing who have suddenly become very positive, but they happen to be the ones who went through a tremendous amount of panic at the beginning. There are some of my friends who actually had many employees under them, but they said, I've got to get through this.
Right.
They sat down, they managed to focus themselves. And this is the crux of what I'm saying. If you cannot focus to put yourself in a good place, then there could be something else going on, especially if this carries on over a prolonged period. So that is why it's important to recognize, your own vulnerabilities, as well as certain factors. There may be protective factors um, for your own sense of resilience. You will notice that a lot of our parents, when they heard about this lockdown, they were like, "Oh, okay, so what?" Yes, they've been through a lockdown um, during the May
Ages
13th,
ago, yeah.
1969. Yes, although it was only 1 week, but that was a much, much more stringent lockdown. So for them, it didn't really hit them that much,
Yeah.
But um, it also depends on what I was saying earlier. Your pre-morbid coping skills. What type of coping skills did you possess before this? When there were disappointments in your life in the past, how did you overcome them? How long did you take to get through them? How much of self-awareness of what's going on within yourself and around you, how much of that do you possess? How much of mental flexibility do you have? If you are going to be very rigid, you're thinking, no, my life was supposed to be this way, and I don't see it going back to, um, I don't see it going back to how I envision it to be. These are very different times. There is probably going to be a new norm. I don't know how much of our old life we can get back, but we've got to constantly adapt. And if you have the skills to do that, I think you'll be able to get through that. This
Right. Yeah.
Another thing is how much can you let go, not only physically, material things, but how much can you let go mentally? You know,
Yeah. I think that's quite interesting because I think some really find it very hard to let go. And we always use that term. We always use the term of let go, let come.
yeah,
It's like a monkey bar, and some are just holding on to what they have. Some are trying to let come but don't want to let go, and then
yeah,
they go back to the past again, and just not able to move to the next bar.
yeah.
And this is,
But,
like you
but
said,
like
it's
I
quite.
said, sorry, Heta, like I said, sorry to interrupt you, but
No, not at all.
like I said, we can't really classify things according to how it has been dealt with before. Like if you're talking about some Australian researchers just sometime last week came out with possible staging for this present lockdown, and came up with 5 stages that you look at it, it resembles the thanatological stages of grief. You know,
Mm,
disbelief. Then they say the next stage is anger. Then there'll be sadness, and then there's acceptance, and finally optimism is the result. But what we are seeing here is something slightly different, mainly because I think Malaysia was quite well prepared for it. So I think a lot of people feel very secure. I think our frontliners, under the stewardship of our Director General of Health, are doing a fantastic job.
they're really
And
doing a fantastic job.
yeah,
Yes.
not only that, the citizens, I'm so impressed that most people are complying. And I feel safe going out, knowing that people take their lives as well as the lives of others as seriously as how I do. So these are things that would help in having a sort of uniform, some uniformity in our sense of security.
Mm. Yeah,
I think
I definitely.
some countries did not have that. And that's why there's a lot of anger. There are a lot of people who can't move from that anger stage, from the first fear stage. They're not moving on.
Mm,
And we are seeing some countries having protests. And that is, um, I wouldn't just let it boil down to the lack of education. I'm sure some of them are educated. It's just that
right.
the way priorities have been put over here, our priority was to look after each other, to make sure that we
Mm,
don't infect someone. You wear a
mm,
mask, not
mm,
because it's going to protect you more than it's going to prevent you from passing the virus to
right.
someone else. And
Right.
this is what is increasing the stress among the frontliners, because
Mm,
they are going out on a limb to look after
mm,
us. We are being responsible, but some people are just being very callous about it.
yeah. And we cannot afford to, obviously. We cannot afford to because it just takes one. It just takes one, literally, in a situation like this. So, thank you so much for that. I just like
No.
to ask, you know, in a very simple sentence, how do I know whether I should seek professional help?
Okay. The initial stage. Let's leave the first 1 week after after going into this crisis, where you would have had butterflies in your stomach, you would have had palpitations, you might have lost weight, you might have
Mm-hmm.
lost sleep,
Mm,
right?
mm,
Um, you feel sad. There could be some negativity. You could be irritable,
mm.
especially if there are too many people at home, being locked down together.
Yeah.
Uh, but if this persists beyond a 2 week period, I think you should take it seriously, especially if
Mm.
it doesn't show any signs of letting up.
Yeah, I think I would definitely, not like I am a psychiatrist, but definitely in the space of psychology. I think if anything is lasting for more than 2 weeks,
Yeah.
um, the,
Persistently.
they're two very valuable reasons why you should speak to a professional. And please note that this is not an advertisement to go and see Dr. Prem, or I don't do counseling anyway, so this is not about me either. The two great reasons. Number one, you get to have a confidential discussion with somebody who's obviously professional and can help you professionally, because our friends and our family members are going through some probably the same thing, and they may not be the right person to be able to walk you through this journey professionally. And the second is that if you keep anything going on for more than 2 weeks, as you would know, it becomes a habit, and you might end up having the whole entire pandemic experience. Um, you might end up having the same pattern throughout this whole experience. So you may as well break the pattern early on.
Yeah.
And personally, I seek my own I seek my own professional help as well, because as I help others, if I'm not in a good space, then yeah, the worst part is actually getting a lot of of the challenging energy from other people, and I need to clean myself as well. Otherwise, I'm probably going to end up being in the same space as everybody else. So I don't think. I mean, I think anybody who's going through anything for more than a week or 2 weeks, just go and get help. And there's so many there's so many free hotlines out there, and I think maybe we'll talk a little bit about pricing, and where people can get like affordable support as well, if we can, in the next session potentially.
Right.
Yeah. So with this, what is one advice that you would give everybody, like in a very simple way? What is an advice that you give everyone to keep their, as a lot of people are saying, their sanity in check, and
Yeah,
hopefully
keep thinking
right?
about yourself. We will all get through this, but do not have unrealistic expectations, because it is not going to go back to normal. The normal that we know. Even
Mm,
after the MCO is lifted, the government is already talking about something they termed a soft landing.
mm,
That would mean that you'd probably go back to your to work, go back to a lot of your usual activities, but you're still required to maintain social distancing. Your restaurants are still not going to be open, and even if they are, you're not going to sit anywhere near anyone else. There's going to be things are going to be different, but some people have told me, oh, this is a sort of good reset. Reset to what? Reset to how things should be. But the way I see people looking out for each other, the way I see that how people are being more considerate of looking out for other people, I think if there's a reset, it might be in a good way.
Right. So
We just have to stick with it. All of us will come out of this just fine.
right. That's very hopeful. That's very hopeful. So a couple of pieces of summary for everybody, and I will do my part to make sure that I summarize this in our content as well later when we repost. So a couple of interesting things. Human behaviors, however we are behaving today, is probably learned behaviors. And there is a huge opportunity to learn new behaviors. We don't have to go back to old ways of reacting in this new world. And typically, you would have learned a lot of it from parents or family members that you grew up with. The second thing is that obviously COVID-19 is a very unprecedented event, and it has evoked a lot of fear, and predominantly via media. I really love this one. This is definitely something I will take away from this, and I think I probably definitely fit into this one. We can start off with the heroic stage. A lot of us, like, we want to do something or we should do something. Then it goes into a honeymoon stage, and then it goes into a self-centric, potentially a self-centric stage.
Yep.
And then we go into a new reconstructed stage. This really sounds like a marriage or a new partnership or joining a new company, where we sometimes get a bit excited or a bit fearful, and it kind of normalizes after a period of time. We're also talking about how a lot of these stages of from fear to learning and growth is happening very slowly for a lot of us, and it's also happening in staggered stages, and it's probably moving back and forth, potentially, as new triggers take place. You're also talking about symptoms, that symptoms should dissipate after the first 2 weeks of the launch of MCO, but dissipate not in the sense that it's eradicated, but it's not persistent for 2 weeks in a row. Is that correct?
Yeah, I mean, it shouldn't be of the same intensity and showing no signs of
change.
no signs of lessening.
Right. I love that you say the best indicator. So I think some of you were saying, what are the symptoms? What do I need to know about symptoms that I'm not doing well? I love that you talked a little bit about what is an indicator of the fact that you're doing well. And what you said is that if you can actually sit down, you can stay focused for a little while at least, and you can put yourself in a good place, that's a great sign already.
Yep.
And a valuable thing for you to do is to utilize prior coping skills that you have used to overcome previous difficult circumstances, and also leverage on learning new coping skills. What you said about what can hold people back is that the inability to let go, or mental rigidity or mental fixation about how life is, how life should be.
If you're not able to be mentally flexible, that is going to be a problem. But to be able to accept and sustain positive emotions and see some way out of this, and use whatever skill you have or talent you have, and if it makes you feel better that you are helping someone else, or if it makes you feel better to indulge in something that you've always wanted to do but never had the time, then go ahead. That shows that you are actually evolving, you're progressing, you're getting better, you're accepting it.
Absolutely. And some of you who might be, so when you should seek professional help, definitely if you're already 2 weeks of the same intensity of emotions, potentially, the ones most at risk, obsessive about the news, so please immediately stop that. You can definitely control it, so stop that. Those of you who have past history of mental related illnesses, currently seeking medical treatment, and so on and so forth. Frontliners and certain demographics, so single parents, people who are single or don't have enough support, those who are a bit older, those who are a bit younger, and those who have personally gone through a personal or professional crisis. And I like that that there is a lot of hope for Malaysians in the fact that you do believe, and I think there's enough for us to believe that Malaysia is doing a phenomenal job, and we are really lucky to be in Malaysia right now in managing COVID-19, not only from the government side of things, not only from the frontliners, but also as a community, as a collective. We are doing our part, which is great. And what you're saying is, and if I could add to that as well, don't have unrealistic expectations. Maybe just have clear expectations, or set expectations that are viable in these circumstances. Because this is going to take a long time, and what you're saying is that the government is thinking of a soft landing approach, which means that even when MCO is potentially lifted, or to a certain degree, that there will still be a huge amount of social distancing that we need to comply towards as well. Yeah.
There will be restrictions, but I mean, it won't be as bad as it is now. But I think people have started to realize that being responsible is the way to go. And I think everyone appreciates everyone else's efforts. Like I said, we are all in this together. And when this first hit us, all of us went through the same emotions. So if you are still having those negative emotions after 2 weeks, there's nothing to be ashamed of. Maybe you could just reach out for help.
Right, will do. And we have one question now, but I'm completely out of time already. And it's a very good question. We'll take it on the next one, because this is also about treatment. Being counselors or therapists ourselves, how can we deal with the negativity of the surrounding and continue to help others without letting their issues affect ourselves? Yeah, so we'll definitely cover this one the next time around. And that'll be interesting to hear how you are doing it.
I was actually going to deflect the question to you.
That's what you have when you have two psychologists, or a psychiatrist and a psychologist. How are you doing? No, how are you doing? Yeah, maybe you could end off by sharing a little bit about what you are doing to cope and to stay clean emotionally.
At the next session, right?
Yes, we can do that the next session. Yeah. Thank you so much for this. You've been a real pleasure. Definitely a topic that we should continue to talk about. And I really love that you kept it very constructive. And that's definitely the way to go with mental health related conversations. Beautiful. Thank you so much for your time. Really appreciate it.
See you at the next session.
Bye. 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 Bye.